Good morning, Professor. My name is Harmandeep Kaur, and we are four members in a group. My group member name is Nishima, Kulpreet, and Jasjeet. And today we are presenting the big concern of the society, that is low socioeconomic status in women in Oakville, age between 18 to 50 years. And I will discuss the introduction of the topic, identification of the topic, and reason why we choosing this topic, as well as the assessment methods. First one is introduction of the topic. As we all know, low socioeconomic status describe people who are struggling financially, have limiting access of resources, as face socioeconomic disadvantages that make it difficult for them to find work, get an proper education, get healthcare facilities, and afford housing. In Oakville, population have 10% lower socioeconomic status than any other Halton regions, particularly in women, that is age between 18 to 50 years. Women of the Oakville between 80 to 55 years has 98,795 lower socioeconomic status than the men. Now I will discuss the reason for choosing this community. We choose this society because of the gender inequality in income, Oakville's high cost of living, as well as the unique challenges in assessing, resourcing, and achieving social mobility in women, and address the inequalities in health and fostering well-being of this population. Now I will talk about the community identification. In community identification, there are some parameters, that includes location, socioeconomic status, and statistics. In location, we choose the Oakville society, and low socioeconomic status, there is the low income of that society. And statistics, it's around 8.7% people suffering from low socioeconomic status. Now I will discuss about the assessment method. There are different assessment method to assessing that community. First one is assessment survey. In this we can collect quantitative data that is related to their socioeconomic status, health needs, as well as the demography and availability of resources. And the next method is windshield survey. In this we observe physical and economic environment, as well as we assess the availability of the resources. Thank you, Professor.
Hi Professor, my name is Nishima and I will be continuing with the assessment methods, and the first one is the focus group discussion, in which we're gonna gain qualitative data and talk about the personal experiences and prioritize the women, and we're gonna ask them or talk about what are their personal experiences, their strengths, their challenges, their emotions, and their feelings. Next one is to review existing data, in which we're gonna analyze the available data that we have from the reports, research studies, which is related to the low socio-economic status. Next one is the rationale for this assessment. In this we wanted to know about the strengths and challenges that the person or a woman face as a low socio-economic person. Next is to inform the program development. We are gonna let them know what are the programs that they can use as to develop their level, or to know about more their facilities that they can have, and advocate for the change. For example, to take the authority to bring those change, and to adapt new trends and techniques, and to adapt new availabilities. For those, the information that we are collecting is from the Statistics of Canada, the local government reports, and the Oakville Community Foundation, because they provide the most accurate and accessible data that we can take. Next one is the current situation of the community. So in the Oakville, and the women who live in the low socio-income households have a numerous disadvantages or difficulties that significant affect their health and well-being. For example, in this, which includes because they don't have proper access to the education, as they have limited access to the education. The next one is the less employment opportunities. They don't have higher opportunities to study further, or to get a job, or to do a job. Inadequate housing and healthcare facilities, like inadequate proper sanitation facilities, and mental health issues, which can come from the stress, anxiety, or depression that they are having as a low socio-income status. Next is community strategies. In this, we can strengths includes the strong social networks, like potential for peer sports and community buildings, resilience and resourcefulness, to ability to overcome those challenges, and advocacy groups, the organization, the working for human rights. Thank you.
Professor, good morning everybody. My name is Shashid Kaur. As my group member Nishima, she already discussed about the community strategies. Now I will further continue with the challenges. So basically there are 4 challenges. The first one is when there is a lack of affordable housing and the social rejection faced by a community population, and they also feel a social isolation of it. The another challenge is a lack of the healthcare services, and the last one is when there is a lack of the employment or there is a low wages in a community area. Now another one, further I discuss about what all are the strategies that how to overcome these kind of challenges. So the first strategy is when there is a skill development programs, so that to enhance the employment in a specific area. The another one is education or training programs for enhance the career development. And the another strategy is when there is a advocacy for increase the affordable housing and better options for the child care. The another strategy that we can opt is make an improvement in a public transportation so that the people get better accessibility. And the last strategy is when there is a creation of a safe spaces and a social support networks for helping the population in a community of the Oakville. Now I will discuss further about what all are the resources that are already exist for a woman those who are in a low socioeconomic status. So the first existing resource is the Oakville Foundation program for providing a fund for gender equality, and the another one is for the increase our personal awareness for the needs of the community. There is 100 women who are in a Oakville, and there is a certain kind of programs for the employment. And the last one is there is a food banks and the community meal programs that are already there. So another one I will discuss about what all are the gatekeepers and the stakeholders of the community. The members that who are included in the gatekeepers is the social leaders, those who are making the policies, the policy makers, influential community members as well included in the gatekeepers. And in the stakeholders, there is a certain kind of the advocacy groups, government agencies is there, community members is there, local organization members is there, and the another one is the healthcare provider, which though these all are the members who are included in the gatekeepers and in a stakeholders.
Good morning, Professor. My name is Kulpit Kaur, student ID 165369224. Now I'm going to discuss about what are the unheard voices in the community assessment. First one is the women who experience homelessness on the unstable housing. Second one is women with the childcare responsibilities, and then women who are undocumented or the fearful of the deportation, and last one is women with the limited English proficiency. Now I'm going to tell you about how we're going to include the women in the community assessment process. First one is partner with the community organization, then offer incentive for the participation, and then use the creative outreach methods, and last one is the translate materials and the offer interpretation services for the community. And then I'm going to discuss about what the strengths, limitation, and strategies we will gonna use for the community assessment. Strengths are provide the valuable data on the needs and the experience of the population. Next one is inform the development of the targeted support programs and the services. Last one is we will gonna raise the awareness of the issue within the community. Now, what are the limitations? Quantitative data may not capture the richness of the lived experiences. Next one is this data will gonna be time consuming to organize and analyze data. Certain demographics might be harder to reach. Next one is the strategies. In strategies, first one we're gonna include is analyze existing data. It includes income statistics, housing data, and the healthcare utilization. Last one is conduct the community mapping. In this, we're gonna identify the resources and the services gaps. Next one is advocacy and ethical consideration. In advocacy, first we're gonna reform the policy and then support the community programs and then awareness campaigns. We will gonna do it. Ethical considerations, informed consent. We need to inform the participant and ensure the participant understand how their information will be used. Confidentiality, we will gonna maintain the confidentiality by protect the privacy of the participant. Respect, we will gonna treat all the participants with the dignity and the respect. Now I'm going to tell you about how what we learned as a group about this vulnerable group. First one is importance of the including diverse voices in the assessment process. Next one is the challenges faced by the low socioeconomic women in the Oakville. Next one is the value of the community collaboration in addressing social issue, and last and the least is the importance of ethical consideration when the conducting research. Thank you, Professor.